Hello, in this video demonstration, we will be focusing on how easy and accurate different tracking is within our Mahler Health system. Now, what we're looking at here is the scheduler, and what makes our system unique and very efficient is everything is based on events. Whether you are having a follow-up appointment, new patient consultation, or different therapies, our system is going to track that event itself. So we do have patient records and everything, but what's vital is that you're actually tracking the event itself, whether it's a treatment or an appointment, whatever it is, we're going to track from that event. Now, we also have requirements for the different event types. So this ensures that you are going to collect all the information that is needed for any particular event type, whether you're doing a therapy or procedure or anything else that you're doing. It's going to have different requirements that are needed, and the requirements make it extremely easy to fill those out and ensure that you are gathering all the relevant information that is going to be needed for future analysis on these different events. Now, our system is comprised of a lot of grids like you see here. We're not going to focus on those during this particular demo, but just know that you can decide what you want to see in these grids. You can rearrange these columns how you want. Our scheduler itself, for example, you can have over 100 different columns of data in here. You get to decide how you want to view that. It's a workable grid. You can also group things by the different columns of data. There's a lot that you can do to make this extremely efficient for you and your practice. Now, we're going to go ahead and go into one of these particular events. Now, you can see over here that the requirements have not been completed on any of these events. Before we get into the actual event itself, it is important to understand that this data that comes in is either done through our system itself, or we are really good at connecting to other systems. So if you have multiple other systems that you're using, our system has all the APIs needed for connections. We'll work directly with any third party to get the data into our system. We do it quite often. Just like the devices that we're connected to, we connect to other systems all the time as well. So either the data is flowing into this system, or you're just using this system for your full EHR and practice management solution. In any case, you're going to have a nice scheduler with your different events in it. Now, when we go into this particular event, for example, right away, you're going to see the event requirements. Now, you do have access to access anything that you want for this particular patient, medications, the details for this patient, history, different charts, notes. A lot of times you're going to focus right away to start, though, on the different event requirements. You're going to see what has been filled out and what has not. Now, we have patient level forms and charts, so this is at a patient level. It flows through, they fill this out once, and it's going to flow through every single event for that patient. Event level forms and charts that may be required for the different event types, those are going to be specific for the event itself. So if you're doing a procedure, you're going to have the event level forms and charts that are going to be required for that particular event type. When you go into one that has been completed already, you get to see a nice formatted PDF of the data that was filled in. You have patient signatures. There are also provider signatures. We have a plethora of different form and chart types that you may choose from and create your own as well. Now, you also can see anything else that may have been filled out or started within the system. And one that I'm going to focus on here is the PRP outcome tracking, just to show an example of what you can do with data over time. So you can go ahead and when you view the data, you can see anything that has been filled out. Now, in this particular case, we're connected to this particular device itself, so the data automatically is coming into our system, but we'll show how easy it is to fill these out if you aren't connected directly with the devices. In this case, we have a nice flow grid. Now you have the ability to choose what columns of data you want to see, that you don't want to see. You can include or remove any particular column of data that you want, and then you may actually save this as a default. So anytime that you come into this particular flow grid, you're going to see it with your settings that you have in place. Now, what's important though is you have the ability then to quickly see and analyze over time what's happening with this particular patient. You may export this to Excel. Now, this is a simple example of a flow grid for just one particular patient and one particular chart. Our detailed reporting and analytics allows you to create basically a patient registry of any data point that you want in our entire system and save those particular reports for all of your different patients that you have, so you can see trends. There's a lot going on behind the scenes. Now, we make the data collection extremely easy though. So for example, let's go ahead and load one of these. You can see filling it out, everything is going to populate that has been populated previously. This really increases the amount that the patients will fill out as well. We have an extremely high percentage of patients that fill out their particular forms and charts, whether they're the initial forms and charts that you want them to fill out or if they are follow-ups. We have a great email templating system that reminds them to fill out their particular forms and charts for like a 1 month follow-up, 3 month, 6 month, whatever it is that you want for that follow-up information for the patient reported outcome measures. And we're going to show the patient portal in a little bit here. And while we're here though, we also have this particular one is automatically bringing in data from the device itself. It's a Mindray device that we're bringing in this particular information. But just for the point of example, we have calculated fields as well. So if you go ahead and change a value here, now I'm going to ask you to look down here, and this will change as soon as I change one of these values up here. If for whatever reason this was a different value, now watch here, as soon as I change it changes there as well. And then if we go back, you can see that it automatically changed. So our system is making it extremely easy. You don't have to calculate anything. It's doing all the calculations for you, and it's making it really easy to fill information in. Now, if you notice the different microphones as well. So when you go ahead, you can go ahead and do voice to text as well. And so that's going to fill out based on what you were saying. I'm going to go ahead and remove this, but it makes it extremely easy for you to fill in your information because you have the ability to type things, voice to text. It was designed for your mobile devices. This works great on your phones, tablets. It was designed as a progressive web application, so there aren't any additional downloads that are needed. Patients are very willing to simply click on a link and log in. Some patients are hesitant to actually download apps. All these little things make a huge difference when it comes to actually getting patient-reported outcome measures. Yes, our system makes it extremely easy for your clinical outcomes as well, but it's important that the patients are going to fill out and do their part also. So now let's go ahead and go over to the patient portal. Now, the patient portal, they get an email. It's easy for them to log in, and they can see right up front the different forms and charts that they have to fill out, whether these are the reported outcomes or the initial questionnaires that they're filling out, and they can also see any forms or charts that have been completed. Now, they also will see any of their upcoming appointments. In this particular demo, all the appointments are in the past, so they aren't seeing any upcoming ones in this particular view. But they can go ahead and fill out their particular forms or charts that they have to fill out. For example, the shoulder pain questionnaire, great. They're going to go ahead and fill this out. And this will flow through then to the provider view and the practice view that we were looking at previously. Now, also, anything that is filled out previously is going to be filled out for them. This is great because this really helps them. Patients never have to duplicate information. Practices don't have to duplicate information. If there's a mistake and the providers make the change, great, it flows through to the patient as well. This is really important for making sure that your patients actually do fill out this information. When patients have to duplicate information, the percent that actually fill out goes down, down, and down. With our system, very high percentage of people that will fill out all of their information. They have access then to any of the labs or anything else that you have collected for them. They have easy access to view this within the system, anything that they've signed, any of the forms or charts that they have filled out previously and or that you have given them access to, they're going to have this in their patient portal. Now, that makes it extremely easy for them to fill out information. And the great thing is, now back to the provider view, is that you have that in your portal and all of that is easily reported on. Now, let's go over a different particular event type. The first one that we looked at was a follow-up appointment, and you can see that in this particular demo, we just have that the SOAP note is the only particular note or form or chart that we want at the event level. Our templating system, our note system is extremely easy to use as well. It's going to bring in information from anything that has been filled out previously. It's really easy to do your notes in our system. Now let's go ahead and look at a different event type, a new patient consultation. In this particular one, you can see that we have different event level forms and charts. And we also have different patient level forms and charts for this particular event type. Now, you go in and you can see, okay, great, this is the information that we're going to fill in automatically, or we're going to have a provider or somebody fill that in. And then once it is filled in, it will flow through to all these other forms and charts as well. So as here are just some examples. Anything that has been filled in, great, you're not going to have to fill in again. And you can see a lot of this particular one has been completed. Also, when we have required fields of data. So if somebody saves, they can save as much as they want, and or when they try to complete, then it's going to highlight what fields of data are required. This makes it nice it helps make the patients actually fill in the data that you want, and you are able to collect all the required fields. So within the system, everything that we've talked about then provides all of the data that is vital for your different analytics, for your outcome measures, and you then have the ability to create any particular grid of data that you'd like with any field of data that's in any of these forms or charts. That's the beauty of this system, is that every single one of these forms or charts that we have in the system, we're collecting the data in an extremely easy to use fashion. And yet you are actually collecting all these data points. We're connected to your different devices. We're connected to your ultrasound machine, connected to the hematology machines. All your devices, as many as possible, will automatically send data automatically to the system, and yet you do have the ability then to view that data in an easy fashion. The patients are alerted to that information when they need to fill something out. We have a very high percentage of completion rate for the patients completing these forms and charts. It just makes it extremely easy to ensure you're gathering the information that's needed, and then you have the ability to report and analyze any of that information.